Good morning, everyone. My name is Nishani Sandran, and today I will be presenting about the AV Node Dysfunction, specifically third degree ventricular block, also known as complete heart block. The AV node is an important component of the cardiac conduction system because it transmits the electrical impulses from the atria to the ventricle. This image shows the normal cardiac conduction pathway, including the SA node, AV node, bundle of His, and the puncture the fibers. When the conduction through the AV node completely fails, the atria and the ventricle beat independently, resulting in complete heart block. This slide illustrated the normal cardiac conduction pathway and the normal electrical activity of the heart. Normally, the electrical impulse begins at the sinoatrial node or the SA node, which function as the natural pacemaker of the heart. This slide demonstrates the ECG finds and the ECG measurements the third degree ventricular block, also known as the complete heart block. Under the normal conduction, electrical impulses travel from the SA node through the AV node to the ventricles, producing coordinate atrial and the ventricular contraction. However, in complete heart block, conduction through the AV node completely fails. As a result, the atrial and ventricle beat independently. This ECG clearly demonstrates the complete AV block and AV dissociation. The small waves labeled here are the P wave, which represent the ventricle depolarization. The PP interval remains regular, indicating the atria continue to depolarize normal under the control of the SA node. The QRS complexes represent the ventricle depolarization. The R to R interval is also regular because the ventricle are maintained independently by the junctional expector rectum. There is no relationship between the P wave and QRS complex. This phenomenon is known as the AV dissociation. The atrial is approximately 85 beats per minute, while the ventricle rate is approximately 38 beats per minute, indicating several bradycardia. There is also no fixed PR interval because atrial impulses are not coordinated throughout the AV node. This finding the characteristic of the third degree ventricular block, also known as a complete heart block. In this slide, represent the real ECG from the published clinical case study. In the point of the ECG demonstrates the complete heart block with AV dissociation. In the point of the P wave and the QRX, the atria and the ventricle are functioning independently due to the failure of the AV conduction. In the point of the clinical importance, the complete heart block is clinically important because it may reduce the cardiac output and lead to dizziness, syncope, heart failure, or cardiac arrest if not treated properly. This slide is summarize the common causes and the symptoms of the complete heart block. In the point of the causes, the common causes include the myocardial infarction, coronary artery disease, and the degeneration of the AV node, electrolyte imbalance, and drug toxicity. In the point of the symptom, the patient commonly present with the bradycardia, dizziness, chest pain, fatigue, syncope, and the shortness of the breath. So the overall is the several safe case may progress to heart failure or the sudden cardiac arrest. This slide explains the treatment of the complete heart block. In the point of the ECG demonstrates the several bradycardia due to the failure of the AV conduction. So in emergency management, the initial management includes the oxygen therapy, cardio monitoring, and the temporary pacing. So however, the definitive treatment is the permanent pacemaker implantation. The pacemaker is restores the coordinate ventricular rhythm and improves the cardio output. In summary, the AV node plays an important role in transmitting electrical impulse from the atria to the ventricles. In the point of the ECG, the both ECG demonstrate the complete heart block with AV dissociation and independent atrial and ventricular activity. The characteristics of the ECG is AV dissociation, several brachycardia, independent P-waves, and QRS complex, absence of fixed period interval. The early ECG recognized the pacemaker implantation are important to prevent the life-threatening the complications. Thank you for your attention. The third degree antivacular block is a several form of AV node dysfunction that require rapid ECG recognition and immediate management. Thank you.